Hello everyone, and welcome back. Today, we are going to talk about a very important topic, hidden health risks in newborn babies. A newborn baby may look peaceful, tiny, and healthy on the outside. But because newborns cannot speak, cannot point to pain, and cannot explain what they feel, some serious health problems can be difficult to notice at first. For new parents, this can be scary. A baby may sleep a lot, cry often, feed every few hours, and make strange little sounds. Some of these things are completely normal, but sometimes small changes can be early warning signs. In this video, we will talk about the hidden health risks that parents and caregivers should watch for during the first days and weeks of a baby's life. This video is for education only. It is not a replacement for a doctor, nurse, or emergency medical care. If you are ever worried about a newborn, it is always better to call a healthcare professional. Let's begin. Newborn babies are very different from older children and adults. An adult with an infection may say, "I feel cold, my throat hurts, or my stomach hurts." A toddler may point to pain or cry in a specific way, but a newborn has only a few ways to communicate: crying, sleeping, feeding, moving, and breathing. This means that illness in a newborn may appear as a general change. The baby may feed less. The baby may sleep more than usual. The baby may be harder to wake. The baby may cry differently. The baby's skin color may change. The baby may breathe faster or harder. These signs may seem small, but in newborns they can matter a lot. Another reason newborn problems can be hidden is that their immune systems are still developing. A minor infection in an older child may be more serious in a newborn. Their bodies are small, and changes can happen quickly. That is why parents should not ignore their instincts. If something feels wrong, even if you cannot explain it clearly, it is okay to ask for help. One of the most important warning signs in a newborn is temperature change. Many parents know that fever can be dangerous, but in newborns, even a mild fever can be serious. A fever in a baby under 3 months old should be taken seriously because it may be a sign of infection. But fever is not the only problem. A newborn can also be sick with a temperature that is too low. Sometimes very young babies do not respond to illness the same way adults do. Instead of developing a high fever, they may become cold, weak, sleepy, or difficult to wake. Parents should know how to take a baby's temperature correctly and should ask their doctor which method is best. If a newborn has a fever, a very low temperature, or feels unusually hot or cold, parents should contact a healthcare provider right away. Do not simply give medicine and wait without medical advice. Newborns need careful evaluation. The hidden danger is this: a baby may not look extremely sick at first. They may only seem sleepy or feed less, but temperature changes can be an early sign that the body is fighting something serious. So remember, with newborns, temperature is not something to guess about. Measure it, take it seriously, and call a doctor when it is abnormal. The second hidden risk is breathing trouble. Newborn babies often breathe in irregular patterns. Sometimes they breathe fast then slow down. Sometimes they pause briefly. This can make it difficult for parents to know what is normal, but there are certain signs that should never be ignored. Watch if the baby is breathing very fast. Watch if the baby's chest or ribs pull inward with each breath. Watch if the baby's nostrils flare. Watch if the baby grunts while breathing. Watch if the baby's lips, face, or skin look blue, gray, or very pale. Watch if the baby cannot feed because breathing is too difficult. These can be signs that the baby is not getting enough oxygen or is working too hard to breathe. Breathing problems may be caused by infections, lung issues, heart problems, or other medical conditions. Some breathing problems can become serious very quickly. One hidden danger is that parents may think maybe the baby is just congested, or maybe this is normal newborn breathing. But if the baby seems to struggle, uses the stomach or shoulders to breathe, or looks blue or very tired, this is not something to wait on. Breathing is life. If a newborn has trouble breathing, seek medical care immediately. Feeding is one of the best signs of newborn health. A healthy newborn usually wakes regularly to feed. Some babies breastfeed, some take formula, and some do both. Every baby is different, but a major change in feeding can be a warning sign. A hidden risk appears when a baby suddenly feeds less, refuses feeding, sucks weakly, falls asleep too quickly during feeding, or cannot keep milk down. Newborns can become dehydrated faster than older children because their bodies are very small. Dehydration means the baby does not have enough fluid. Parents should watch wet diapers. A baby who is not peeing enough may not be getting enough milk or may be sick. Dry mouth, no tears when crying, a sunken soft spot on the head, unusual sleepiness, or very dark urine may also be signs of dehydration. Another warning sign is repeated vomiting, especially if the vomit is green or yellow. Spitting up small amounts can be normal in babies, but repeated forceful vomiting or colored vomiting vomit, needs medical attention. The hidden danger is that dehydration may begin quietly. At first, the baby may just seem tired. Then the baby feeds less, pees less, and becomes weaker. So parents should ask themselves, is my baby waking to feed? Is my baby sucking normally? Is my baby having wet diapers? Does my baby seem alert during feeding? If the answer suddenly changes, call a healthcare provider. The next hidden health risk is jaundice. Jaundice means the baby's skin or eyes look yellow. It is very common in newborns, especially during the first week of life. Many cases are mild and improve with feeding and monitoring. But jaundice can become dangerous if the bilirubin level in the baby's blood becomes too high. Bilirubin is a yellow substance made when red blood cells break down. Newborns have immature livers, so their bodies may need time to remove bilirubin. Parents should watch for yellow color in the eyes, face, chest, belly, arms, or legs. Jaundice that spreads lower on the body or becomes brighter may need medical evaluation. Other serious signs include a baby who is very sleepy, hard to wake, not feeding well, crying with a high-pitched cry, arching the body backward, or having a fever. The hidden danger of jaundice is that many parents think yellow skin is normal. Sometimes it is, but not always. Severe jaundice can affect the brain if it is not treated. The good news is that jaundice can often be checked with a bilirubin test, and treatment is available. Parents should follow all newborn checkups, especially during the first days after leaving the hospital. If your baby looks yellow, do not panic, but do not ignore it. Call your doctor and ask if your baby needs to be checked. Infection is one of the most serious hidden risks in newborn babies. A newborn's immune system is still learning how to fight germs. This means infections can become serious quickly. The signs of infection in a newborn may not be obvious. A baby may not cough strongly. A baby may not show clear pain. Instead, infection may appear as fever, low temperature, poor feeding, unusual sleepiness, weak crying, fast breathing, vomiting, diarrhea, skin color changes, a rash, or a baby who just does not seem right. Some infections can happen before birth, during delivery, or after birth. Newborns can also catch viruses or bacteria from adults and older children. This is why hand washing is so important. Anyone who touches a newborn should wash their hands. People who are sick should avoid kissing or holding the baby. Visitors should be limited, especially in the early weeks. Parents should also be careful with cold, sores, flu symptoms, coughs, and fever around newborns. The hidden danger is that infection may look like normal newborn behavior at first. A sleepy baby may seem normal, a poor feeding day may seem harmless, but when these signs appear together, they can be important. So the rule is simple: if a newborn has fever, poor feeding, breathing trouble, or is difficult to wake, call a doctor immediately. Another major risk for newborn babies is unsafe sleep. Newborns sleep many hours a day, so sleep safety is extremely important. A baby should sleep on their back, on a firm and flat surface. The sleep area should not have pillows, blankets, stuffed animals, or soft objects. These items can increase the risk of suffocation. Parents may want to make the baby's bed soft and cozy, but for newborn sleep, simple is safer. A baby can wear appropriate sleep clothing instead of using loose blankets. The room should not be too hot. Overheating can also be risky. Sharing a room with the baby can make feeding and monitoring easier, but the baby should have their own safe sleep surface. The hidden danger here is that unsafe sleep can look comfortable. A soft blanket, pillow, or sofa may seem harmless, but newborns do not have the strength or control to move away if their breathing becomes blocked. Parents should also avoid sleeping with the baby on a couch or armchair, especially when tired. Safe sleep is one of the most important ways to protect a newborn. After birth, the umbilical cord stump slowly dries and falls off. During this time, parents should keep the area clean and dry. Some mild crusting or a small amount of dried blood can happen, but certain signs may suggest infection. Watch for redness spreading around the belly button. Watch for swelling. Watch for bad smell. Watch for pus or yellow discharge. Watch if the baby cries when the area is touched. Watch if the baby has fever or seems sick. Newborn skin can also have rashes, dry patches, or small bumps. Many newborn skin changes are harmless, but rashes with fever, blisters, spreading redness, or signs of pain should be checked. Recommended by a healthcare provider. Simple care is usually best. Clean hands, gentle washing, dry skin, and medical advice when something Looks unusual. Newborns sleep a lot. That is normal. But there is a difference between normal newborn sleep and unusual sleepiness. A healthy newborn should wake for feeding. They may be sleepy, but they should respond when gently stimulated. They should have some periods of alertness. A warning sign is when the baby is extremely difficult to wake, too weak to suck, unusually floppy, or not responding normally. Parents may think, my baby is just a good sleeper, but in the newborn stage, sleeping too much can sometimes be a sign of illness, low blood sugar, dehydration, infection, or jaundice. Watch the baby's tone. Does the baby feel unusually floppy? Is the cry weak? Does the baby stop feeding quickly because they seem exhausted? These signs are important. The hidden danger is that serious newborn illness can look quiet. Not every sick baby screams. Some sick babies become silent, weak, or very sleepy. So if your newborn is unusually hard to wake or too weak to feed, seek medical advice immediately. Crying is normal. Newborn babies cry for many reasons: hunger, gas, tiredness, needing a diaper change, or wanting comfort. But parents often learn their baby's usual cry. A sudden change can be meaningful. A very high-pitched cry, a weak cry, constant crying that cannot be comforted, or crying with other symptoms may be a warning sign. For example, crying with fever, vomiting, poor feeding, swelling, injury, or a bulging soft spot on the head needs attention. The hidden danger is that people may dismiss crying as just colic. Colic can happen, but parents should not assume every intense cry is harmless. If a baby cries in a way that feels very unusual, especially with other symptoms, call a healthcare provider. Trust your instincts. Parents often notice small changes before anyone else does. Now let us talk about what parents can do to reduce hidden risks. First, attend newborn checkups. These visits help doctors check weight, feeding, jaundice, heart sounds, breathing, and general development. Second, track feeding and diapers, especially during the first weeks. You do not need to be perfect, but knowing the pattern helps you notice changes. Third, practice safe sleep every time. Fourth, wash hands before touching the baby, and ask visitors to do the same. Fifth, keep sick people away from the newborn. Sixth, learn emergency warning signs. These include fever, breathing trouble, blue lips, poor feeding, repeated vomiting, dehydration, severe jaundice, seizures, unusual weakness, or difficulty waking. Seventh, ask for help early. You do not need to wait until things become severe. A simple phone call to a doctor or nurse can help you decide what to do. Next, newborn babies are small, delicate, and precious. Most newborns grow and develop normally, but hidden health risks can happen. The most important message is this: do not ignore changes. If your baby is not feeding normally, not waking normally, breathing strangely, turning yellow, having fever, vomiting repeatedly, peeing less, or simply seems not right, get medical advice. Parents do not need to know everything, but they do need to pay attention, ask questions, and act early. Thank you for watching. If this video was helpful, please share it with new parents or caregivers. Newborn health is something every family should understand. Take care, and always remember, when it comes to a newborn, it is better to ask early than to wait too long.